Hi dear, let's talk about infertility. Infertility is not being able to conceive and have healthy babies after being sexually active for a year if you are under 30 years of age. If you are over 30 years old and have been actively trying for a baby for 6 months without success, it's advisable to contact an experienced fertility doctor or gynecologist to help you figure out why you haven't gotten pregnant for a couple to have healthy babies. Both parties have to be healthy or fertile. It has to be both of them. You know the saying that it takes two to tango? Yes. The man's sperm has to be in perfect condition. His reproductive system has to be in perfect condition. The woman's hormones, uterus, eggs, ovaries, and tubes have to be okay. Uterus free from PID or adhesions, tubes free from blockages, etc. If after trying for a year without success, you are under 30, and after trying for 6 months if you are over 30, please see your doctor right away. He or she will run some basic fertility tests on you both to see why you haven't conceived or had a baby. Some of those tests that you will need to do are seminal analysis with culture to rule out infections, or SFA, for the man. For the woman, hormonal assay ultrasound, mostly done very early in your menstrual cycle, to check your ovaries and womb or uterus, some culture tests to rule out infections, and HSG to check if the tubes are open and the uterus is perfectly fine.
HSG is done by passing some fluid through a narrow tube passed through your vagina to your uterus, and an X-ray is taken to check the womb and tubes. It gives a clearer picture than an ultrasound. This procedure checks the uterus and fallopian tubes to rule out blockages in the tubes or uterus, checking that the tubes are perfectly okay for conception. Another one is hormonal assay. This test will tell if you are ovulating or not, and if not, why not. A hormonal assay checks hormones in a woman's body that are responsible for ovulation and pregnancy. Some women don't ovulate because their hormones are out of balance. Some may ovulate but may not get pregnant because their eggs may not be good enough. The hormonal assay is done on day 2 or 3 of your cycle, mostly day 3 of your menstrual cycle. It checks your hormones to ascertain if your levels are within a normal range. If they are not, there are medications and supplements that can help level out or balance your hormones. It also checks your prolactin levels and your progesterone levels. A progesterone hormone test is done on day 21 of your cycle, or 7 days before your period starts. The hormonal assay checks your FSH, also known as follicle stimulation hormones, LH, AMH, thyroid, estrogen, etc.
After checking out the basic tests, there is still no answer to why you haven't gotten pregnant, or other findings from the basic tests. More tests and procedures may be required. Procedures like hysteroscopy, operative or non-operative, myomectomy, laparoscopy, and hormonal assay for the man, if need be. But let's talk about the basic fertility tests that you should do to check why you are not getting pregnant or having a baby. Here are the basic tests that will be required of you to help figure out why you haven't gotten pregnant. These basic tests will show where the problem is and how you could resolve it and maybe get pregnant. The first one is an ultrasound. This shows your womb, whether there is something there that could be stopping pregnancy or hindering conception. For example, fibroids can cause a woman to have a delay in conceiving if they are too big, or if they cause the uterus shape to change from its original shape. When a woman's womb changes in its original shape, this can make it hard or impossible for conception to occur. Polyps can also be a reason for infertility. These are some of the things that a skin can pick up. The best way to remedy this is by removing the fibroids or polyps through surgery. This could be through major or minor surgery. Another basic fertility test to check why you are having a delay in conceiving is HSG, which is short for hysterosalpingography.